Welcome to Engineering Wellbeing at Jinshan, a podcast where we explore well-being as a bridge. In each monthly series, we take one theme and explore it through four complementary lenses: a systems-level framing, a technology perspective, a specialist or scientific viewpoint, and a cultural Chinese context lens. Because well-being is never one-dimensional. It's biology, psychology, social, cultural, and technology, all at once. Welcome to the Engineering Wellbeing podcast here at Jinshan. Today we have an amazing guest that's going to help us learn a little bit more about sleep.
Thank you, Gerard.
You have an extraordinary amount of credentials. Can you just introduce yourself, how you feel comfortable or how you would like to our audience and to our listeners?
Yes. Hello, everyone. My focus is on sleep and the circadian rhythm, and I think sleep is very important nowadays in our country and also all around the world, because sleep is quite important for everybody's health, especially mental health.
Well, it's important for all of us. And before we get into that, what got you into sleep? I know that you mentioned you have quite a background in different sleep areas.
Yes. As we know, everybody will sleep for more than 1/3 of our 24 hours every day. So sleep is quite important. And I think sleep is not only related to night. Yes, and we need to pay more attention to the awakening. We should consider the sleep as a continuous condition for every day, and it is related to our health, because in 2026 there are four kinds of populations we need to pay more attention to. The first group is students, the second group is shift workers, and the third group is around menopause women, and the last one is aged adult. For the first and the second two groups, they will not go to hospital, because most of them are healthy. Most of them are healthy, but we should pay more attention to them, because if we talk about sleep, it is related to health, but it's also related to the effectiveness of our daily work or daily study, for example.
Wow, I couldn't agree with you more. And actually, those different groups that you mentioned, I would like to learn a little bit more about you from those in particular. Starting with professionals, because you lead a group of professionals at the hospital. Have you noticed any trends in sleep with working professionals?
There are nurses and doctors. They rotate in shifts, every day, and sleep is related to the effectiveness. Also, it is related to the safety of our work, the safety of all the patients. We need to be energetic during the night, during the evening. For example, we need to adapt to the shift. For example, we need to get up at maybe 1 o'clock in the morning. AM, yes, in the morning, and to do our jobs. That's all. So it is maybe a jet lag problem for all this daily routine. It is maybe we are paying more attention to all the patients, but for us, the sleep is also very important.
Yeah, I know doctors, nurses, the staff, they worked incredibly hard to help us.
Yes.
Now also the second group you mentioned, kind of adults. As adults or parents, why is sleep important for them?
Adult, aged adult or young adult, for example, for the parents of kids, which kind of adult?
Like maybe 20s, 30s, young adults.
Yeah. Also, the adult, this is related to the effective of their work, because in China there is a model of work called 966. They, they will work for 9 hours and each week for 6
days a week.
6 days, yeah.
Yes, that's always working.
Yeah, always working. But I will share with you one topic. It is quite interesting. That is, do we need some catch-up sleep during the weekend? This may be a topic. This is maybe every experts have their own opinion for this question. One side they said no, we don't need, because we need the circadian rhythm, stable circadian rhythm. We do not need to, even we have sleep debt, we do not need to catch up sleep during the weekend. But the other side said no, we need to save our sleep. We need to get up maybe during the weekend. We need to get up maybe at 12 o'clock at noon. They discuss. But I think in modern China, especially in Beijing, Shanghai, and other Guangzhou and Shenzhen, like these cities, the young adults are quite. They worked quite hard, and they need catch-up sleep, and they need to perform their catch-up sleep with the help of our sleep physicians. Experts as physicians, yes. At what time should they fall asleep? At what time should they wake up, and especially for that one, this is a important key point. This is key point for them. Sleep is not only sleep, but also sleep and tired. Management of sleep and tired. Both of them are our focuses there.
Well, you're presenting a lot of information there. Yeah. Let's unpack that for the listener that may not understand exactly what's happening. So, with your vast experience, can you tell us, when we're sleeping, what exactly is happening in our bodies?
Yeah, but I think there are maybe 2 or 3 main factors here. The first one is in our brain there are many wastes. We removed outside our brain system, central cerebral system, during the night, especially during the slow wave sleep stage. That is quite important. So as a result, if somebody cannot sleep well, especially lack of SWS sleep, slow wave sleep stage, the waste cannot be removed, and they will be deposited in our brain tissue, and maybe dementia, Alzheimer's disease, and Parkinson's disease will happen. Yeah, that's right. But we need to differentiate which stage is more important for this kind of person. That is SWS, slow wave sleep stage, and we need to do more. As a physician, we need to do more during this kind of stage, not other stages. Yes, that will be a closed loop or locked loop stimulation. For example, we need to work during this kind of stage, SWS stage, and we will maybe, for example, do some laser or light or music.
Treatment with laser
to treat them. Yes, that is the first one. And the second one is the rapid eye movement stage. Yes, REM sleep. REM sleep. Most physicians believe that REM sleep is related to the memory. If the REM sleep is lacking, we cannot erase this kind of memory, and that will help us to be more stable mood.
So if we don't have those big emotions, then it's easier to have the stable mood, and sleep helps with that.
Yes.
Very interesting. Because you brought up different challenges with sleep. I wanted to play a quick 50-second clip for you and just get a quick response from you.
Okay.
I was diagnosed with idiopathic hypersomnia when I was 19 years old. It was a Spanish teacher at Howard University, my first semester in school, who noticed that I was falling asleep in class. There was no one who said, "Oh, you're in your late teens, early 20s. You need to start looking out for neurological disorders."
We all experience spurts of more or less sleep. Many of us, after missing a lot of rest and feeling exhausted, will sleep for well more than the recommended 7 or 8 hours. After that, we feel more wakeful and ready to go about our lives. For people with idiopathic hypersomnia, or IH, that's not the case. Someone diagnosed with idiopathic hypersomnia sleeps for long periods of time, say 11 hours within a 24-hour period, but never wakes up feeling refreshed.
Your initial reaction, this is one of the less common sleep disorders, but what's your initial response to seeing patients and discovering different types of sleep disorders?
This is hypersomnia. I heard that the diagnosis, and that's a narcolepsy. Hypersomnia, right? We need to make them get the tiredness outside of her body. Of her body, yes. That's what kind of methods do we need? For example, bright light therapy. That is the one thing. And second is more, for example, modafinil. Some pills, yes, they can do. Also, maybe some kind of music. For example, pink noise, or other music composed of pink music inside it. That is helpful, and also maybe some sports are not a high high intensity, more moderate intensity, or low intensity sports. That will be helpful.
Now, from working with different patients, what have you found that most people are afraid of when it comes to sleep? Which types of kind of disorders or illnesses have you found that a large amount of patients are afraid of?
I think maybe anxiety.
Okay, so anxiety with sleep.
Anxiety, yes. Or somatic disorder, symptoms disorder, something like that. They will doubt if they are patient of cancer or the patient of some somatic disease, something like that.
Because I know a lot of people will know insomnia.
Yeah.
But I know there's also other sleeping disorders that a lot of people may not have heard of.
Yeah.
For example, some where they act out their dreams, or like in this case, where they don't feel so. Yeah. Do you often have to come across and treat those types of sleep disorders? Or?
Yes. This maybe they are not so common as insomnia, but yes, RBD happened, and also they are. Yes, that is called in Chinese. It will be called guiyatron means a ghost expressed.
The ghost is pushing me down.
Oh yes, that will be the feeling of death. And also RBD, we are afraid of RBD because RBD will be a predictor for some patients who are destined to be diagnosed as Parkinson's disease 10 years before. Yeah.
Wow. Well, I know another connection point with sleep is hyperarousal. Can you kind of explain to us what's the importance of hyperarousal with sleep and maybe comparing that with sleep deprivation? Kind of what's the differences and how they can influence sleep?
Hyperarousal. This kind of terminology often appear in OSA. And arousal, some patients, maybe 1/3 of patients will show the characteristic of hyperarousal. And this kind of people are difficult to treat because CPAP cannot be most CPAP cannot be accepted by this kind of patient because the hyperarousal will think, the mask, yes, the mask will damage my sleep. Yes, and for this kind of people, maybe we need to other kinds of treatment. For example, to improve the condition of their bedroom. For example, more comfortable beds, pillows, and other kind of as an alternative way to get down the AHI, yes, but not CPAP because hyperarousal patient will refuse this kind of treatment. Yeah.
Now you've seen thousands of patients and you've talked about recovery.
Yeah.
What factors do you look for when you see a patient where you can make a guess they'll recover quickly or it will take them longer? What types of things do you look for medically?
Maybe this kind of question I will have an answer distinct from other physicians. I think the most important factor is, especially for insomnia, the most important factor is the belief or something like that. They will trust the patient, trust the doctors and the nurses, and trust means they can control their thoughts. They can follow our treatment and believe they can be cured. They can be cured. And for those patients with mental disorders, for example, depressive disorder or severe anxiety, maybe it will be this kind of patients will be hard to recover. We need to make more efforts to let them have the belief.
So belief is very important, and that connects very well with well-being also.
Yes.
Now, with other treatment models, so I know we have some called like PSG, the sleep model. Yeah. Do you think those are effective models for today's world, or do you think that there needs to be a new model developed?
They are all very important. For PSG, that will be a golden standard, and maybe more than 30 or more than 60 electrodes will be attached to our body in brain or legs or chest, abdomen, and but other model is quite important because the convenient there will be
so many connections.
Yes, so many connections, and they are both very important because from today on the technology, for example, digital technologies are developing more and more, and we can have more choices. That is great because patients, they can be checked maybe inside their own bedroom, not in our ward. Yes. So other kinds of model will be, I think, will be helpful. Yeah.
So you talked about the world and kind of the environment. Do you feel that in today's world we're kind of oversimplifying what's happening with sleep and the importance of it? Do you feel that it's becoming too simple to what we focus on with sleep, or do you feel that there needs to be special attention, particularly from the medical perspective, where we focus on kind of the micro or the smaller elements of what's happening in sleep? Or do you think it's better to focus on the big elements of sleep as a medical professional?
In our hospital, in our daily work, sleep is related to each, maybe is related to each kind of disease, each kind of, to every department of our hospital. For example, it is related to some pain, so surgery, yes, post surgeries. It is related to some itches, so that will be dermatology. And for example, it is related to depression. It will be people will go to the psychiatry. I can give you many examples. So sleep is related to everything. So we cannot use a small perspective to treat it. We need to as a bigger perspective, and it is related to everybody, every day, and every condition.
Well, that's an interesting point that you brought it from society, but you've also said even in hospitals that sleep is connected to each department.
Yeah.
Can you tell us a little bit more, particularly from the medical angle? You just mentioned how it's connecting to each department.
Yeah.
Are there any, I guess you could say, specific medical things that you could unpack for us about, say, for example, connecting to the brain with psychology, or connecting with certain organs that cause different types of illnesses and diseases? Maybe just one or two examples?
For example, in our hospital, the surgeries are pediatrics, and there are some students, because the Spring Festival happiness, but the day and night disorder, circadian rhythm disorder, they will stay hyperarousal during the night, and next week the schools, they will return to school. Yes, they need to get back to the daily routine. They need to come to our department to let the circadian rhythm become normal.
For our listeners, can you explain what is the circadian rhythm? Can you explain that to listeners that may not know what that is?
To help them to get up early and to sleep early, as they did during the semester, or how to say?
During the semester, the regular sleep and wake up patterns.
Yes, it is difficult for them because a 5-week holiday just happened.
Yes, to go back from doing whatever they want to the regular school schedule.
Yes, that's right.
Okay. Well, I wanted to ask you also a little bit about the China perspective, particularly with medical developing in China.
Yeah.
And again, share what you feel comfortable. What have you seen is happening with the sleep industry in hospitals in China?
There is a trend. Maybe in 3 years or 5 years ago, we are focusing and we are waiting for the patients inside our hospital, inside our department. If they cannot endure, they will come. But nowadays that will not happen. How to say, we are
Being
being active to communicate with more people. We will go to some schools. We will go to some nursing care center or something like that. We are going to some factories. We are going to universities, and to tell them which kind of the sleep is good and which kind of symptoms need to be paid more attention. We are not waiting inside our labs or inside our department. Yeah.
Oh, very, very interesting.
Yeah.
So what would you say in your description is maybe the typical sleep profile of a person in China? And when I say sleep profile, maybe just some general characteristics of how they sleep.
Yeah. White paper in 2025, famous brand Huawei Sport and Health, and they expressed their results, their findings in China, their investigation. That is, most Chinese they suffer from sleep deprivation. They do not sleep enough. They do not sleep enough. That is one thing. And the other one is, most of them are between 20 or to 40. Not as we can imagine, not the older adults, not the retired adult. That is
interesting.
Yes, this is important information for us because it is related to labor resources. Yes, this will be a problem of our society. Yes, or maybe most of them are workers, researchers, or students, something like that.
Now that's an age demographic, but from the medical viewpoint also, I know in China we have different tier cities.
Yeah.
Have you seen anything different between the tier 1 cities and
the internet is
yes. The internet connects them all, huh?
Connects them all, and maybe mobile phones or televisions or computers. So the bad habits happened in each tier.
Wow. So we've kind of looked at the environment. We've looked at some problems. We've looked at a couple of routes towards solutions, and then we looked at China context. What I would like to do next is kind of to start discussing some treatments or some opinions where you might feel from a medical perspective, sleep can be improved.
Yeah.
And so my first question for you is, what do you feel is the most difficult obstacle that patients typically have toward getting a good night's sleep?
That should be two points. That is, the first one is habit, and the second one is thought. Somebody, maybe they pay too much more attention to the sleep itself, and that will be a bad choice. And also the habits. Maybe we can persuade them to. As a doctor, I will tell them to get away from the computer or a mobile phone or something like that. They do not nap, reduce nap time during the afternoon, but sleep, because sleep is not like stroke, so they will not follow me. They will not follow me.
Well, that's interesting you mentioned stroke, because I was going to ask you, with sleep, one with the neurological disorders, and then you also mentioned the mind with kind of the psychological. would you say as a professional medical doctor, what advice would you give for the neurological treatments versus the psychological treatments?
Yes, that will be neuromodulation. Yes, RTMS, or that will be repetitive transcranial magnetic stimulation, or transcranial direct current stimulation, or random transcranial random noise stimulation, and alternative current stimulation. Many.
Wow, that's
yes.
That sounds quite professional.
They are all useful. And we know some in the people among the people under below 60s, their mind become more and more. They pay more attention to the side effect of pills. Stopped suddenly, abruptly, that they will pay more attention to. They will focus
like
on the side effect and other kind of. So they will try to choose other non-pharmaceutical treatment, for example, neuromodulation, or traditional Chinese medicine,
TCM.
And other kinds of, for example, CBTI or other without pills. Yeah.
Well, you mentioned the traditional Chinese medicine.
Yeah.
How does that align with the more modern sleep treatments, particularly in hospitals?
Also, there are, for example, there are drugs. And also some acupuncture or massage or other ways, and in Chinese society they are accepted by most Chinese civil populations.
Yeah.
Yes.
Okay. Now, being in charge of different medical staff, what are some common mistakes that you've seen sleep specialists or sleep doctors make with patients in the most modern times?
The most important is the sleep is not. We cannot focus only on the sleep during night. That is. We cannot. Our only goal. Some physicians, their only goal is to make them lie down peacefully. Yes, in bed during night. That is enough.
Oh wow! Why do you think more doctors are making that mistake of only focusing on their sleep at night?
Other departments, they are. Most of them are the patients of other departments. They are not very familiar with sleep medicine, so they choose to they tried some ways to make the patient sleep peacefully during the night. But for the physicians of sleep medicine, we are focusing on if it is they are active enough during the next morning. Yes.
That helps. Now, you have a lot of experience working with different types of patients. If you could create a model concerning sleep, what would be the critical elements in that model? So maybe not the details, but just kind of what are the critical elements that you think would be in that model?
I think that would be the model consists of regular habit, that one thing, and the other one is active sleep ways. That is to say, if we want you to sleep, we can help you to sleep at a certain time, certain stage, and also a passive monitoring. That will be a closed loop. That will be a closed loop. Yeah.
And we'll have a tradition here to where with each guest we will ask them 2 rapid fire questions to where there's something related to well-being, And when we ask the questions, we just want to see what's your initial response. And so there's no right or wrong answer.
Okay.
Okay, so we have 2 questions for you.
Yeah.
The first question is, in your opinion, do you feel that screen time is changing brain psychology?
Yes. For me, yes.
Okay. And with individuals that have high expectations, do you feel they should get more sleep?
No. They want, but the fact is no.
Okay, excellent. All right. Well, thank you for those answers. And so before we conclude, I have one last question for you. So again, knowing what you know, if you could redesign the sleep process from zero, what would you put in that design to help individuals have good sleep and recovery?
All the populations to know the sleep is quite important. We cannot neglect, consider it as natural, consider it as a nothing important thing. But actually, many people, they are not very, they consider the sleep is not very important. That will be the first step.
Okay, so put some more importance into sleep.
Yes, that to make everybody to rethink or reconsider the sleep.
Right. And my last question for you. If you were to give advice to sleep specialists, what advice would you give them so that they could be motivated and encouraged in the future?
Sleep should be considered as important as other kind of department in the hospital, maybe in a comprehensive hospital. They are not. They are not because sleep medicine is a quite brand new department in our country, and in maybe 3 years. Sleep medicine is in neurology, or sleep medicine is in psychology department, or sleep medicine maybe in the
in all the different departments.
Yes, in other departments, for example, pneumonia. What kind of other department, or oral dentist in that department. But nowadays, sleep medicine will be isolated, or will be a brand new department as other departments.
Excellent. Well,
yes.
Thank you for your encouragement and your motivation for today. And this is Engineering Wellbeing podcast here at Jinshan. We will see you next time. Bye.
Bye.
Engineering Wellbeing at Jinshan is about creating bridges between the biology, psychology, and social with a China perspective, where humans can function at their full potential.